So hello all, in this video we will discuss about the management of OCD. So in that we have two types of management, pharmacological and non-pharmacological. Non-pharmacological is what we call it as a psychological management. So the psychological management is basically concerned about the ERT, so exposure responsive therapy. So as the name suggests, expose the patient but prevent the response. For example, patient get a thought of contamination followed by anxiety level increases. So what the patient will do? So he goes and he wash the hand. So anxiety level decreases. But again the intruding thought will come, patient will again go and wash his hand. So this is a loop of cycle which goes in a contamination type of OCD. Okay. What ERT will do is that, so in this therapy, so we will make a patient to touch on the dirty surface, but we will prevent the patient from washing his hand. So this is what basically all of this therapy means. So what happens is that in the first two settings, patient couldn't able to control his intruding thought. Of course, after touching the dirty surface, so anxiety level increases, but we are preventing the patient to wash his hand. So by doing this, eventually like first therapy, second therapy, like doing this for at least like every weekly once, weekly twice, we are doing in a multiple settings, multiple times. What happens by the end of this therapy is that by exposure to the higher level of anxiety, so the patient will be habituated for it. So this is what basically ERT means. So at a multiple session, what happens is that we are keep exposing this patient to the dirty surface, and we are making the patient to touch the dirty surface as the anxiety level increases higher and higher. So there is one point of tolerance where the patient will be habituated to the anxiety. At that point, the anxiety has been habituated. As I said, it is habituated, so anxiety does not increases after this. Eventually patient gets out from the vicious cycle of OCD. So this is what basically the ERP means. Of course, this video is not been for the purpose of replacing your pharmacological treatment. Of course, you can select your best totality medicine. So along with that, you can give a ERT. So ERT is not easy as I described. So it is a very difficult job because the patient doesn't want to do this ERT. So every time the patient wanted to do this ERT, so he started refusing this therapy. So that's the kind of personality we see in the contamination type of OCD. So this is what all about the ERT. So if you add a ERT along with your pharmacological treatment, the result will be best. Thank you.